So I think the first thing that we should talk about is the whole idea of, do we now call it PTSD or PTS? Lots of people seem to be switching to PTS, and for anyone that's not on top of what our an acronym is, PTSD would of course be post-traumatic stress disorder, and PTS is post-traumatic stress. So give us your thoughts on that, please.
Yes, well, I think there is definitely a very strong move away from calling it post-traumatic stress disorder. And in fact, some soldiers don't even like post-traumatic stress. They prefer combat and occupational stress to post-traumatic stress. So that whole phrase could be seeing some disapproval. And there's, in fact, a big difference in the military, in the Department of Defense, as opposed to the VA. The VA still uses, for the most part, post-traumatic stress disorder. But I think it's on the way out. And I think there are two reasons for that. One, you're just not going to get a lot of people feeling real happy about being told they have a disorder, especially when it's a disorder that's been produced by some pretty insane events. In fact, the typical thing people say is it's a normal response to an abnormal situation. So you've got people who are already struggling with this, the effects of a ricocheting psychochemistry, and at the same time they're being stigmatized by being told they have a disorder, and they're less likely to seek help for it. So, and I think it's unfair. I think it's just plain unfair to say to somebody whose brainstem has been hijacked by some extraordinary event that they have a disorder too.
Is there ever a time when you would say someone, the trauma was a year, 2 years, 5 years ago, is there ever a time when you would say it's more appropriate to use the term post-traumatic stress disorder, or would you just say let's retire that term?
Well, interestingly enough, Ruth, and I wasn't even aware of this until fairly recently myself, it used to be that you would call it an acute stress reaction, post-traumatic stress disorder, after 6 months. Well, they just changed that. Now it's after 1 month. So really, what are we talking about here? We're talking about acute stress, and yeah, I think we should just retire the term. It's becoming more and more iffy, and it's overlapping into all sorts of things that don't necessarily make a lot of sense.